Yes,
Can you
sir.
guys see the screen? Okay, thank you. So here we can see OET reading the complete guide part A. Okay, so please understand today's session we will be only focusing on part A. We will not be focusing on part B and part C. So if you guys have any question, any queries for part B and part C, those will be covered, in the coming session. So please do not get confused or do not be worried about that. Anyways, so, in part in healthcare setting, you may need to quickly find relevant information when dealing with the patient or client. Part A simulates this by putting you under timed pressure as you first locate the information and then read it more carefully. As I mentioned you that you will be given a specific time, and I think it's 15 minutes or 20 minutes. In that limited period of time, you will have to attempt this, and trust me, it's very easy. It's very easy once you have control your nerves, once you have practiced a lot, once you know that you have only 5 minutes for reading and 10 minutes for solving the question. Trust me, it will be really easy for you, and eventually you will finish your this part A even before that given time. In this guide, we'll cover the format of OET reading part A and review the skills you are being tested on. There is a sample task plus test tips and preparation recommendations. We'll just briefly look what they are showing here, and then we will move to the practice part. Test format, the four part A text. Okay, so in part A, you will be given four texts. Four texts. Please understand, they in part A there will be sub parts. You will be given four texts. Okay, extracts from the reference materials that you would encounter when caring for the patients. They can include medication tables, dosage charts, instructions, treatment pathways and options, descriptions of presenting factors, symptoms, and diagnostic tools, and at least one may contain information in a visual format. What does that mean? It can be a table, it can be a flow chart, it can be a diagram, it can be a graph as well. Okay, in pediatrics, once we see growth chart, it can be a graph, it can be a growth chart as well. So please, as they have mentioned on their official website, that at least one may contain information in a visual format. So please be prepared that you will be given at least a flow chart, maybe a bar, maybe a diagram, table, whatever this is, you will be given one of that. Okay, so there are 20 questions and three question types. One is the matching, the part one is the matching, the other is the short answer, and third is the sentence completion. Okay, as this part is testing expeditious reading, part A is strictly timed and you must complete all 20 question items within 15 minutes. See, it's 15 minutes. Okay, so what is next? The next is part OET part A reading, part A at a glance. So four text on a single healthcare topic. Okay, 20 questions, matching, short answer, sentence completion, and 15 minutes. So this is all about part A. If you want to know what is part A, this is in first class. Four text on a single healthcare topic, that is good. You will not be jumping around. For example, in part A, the first text is about diabetes, the next is about hypertension. No, it will be only about one healthcare topic, and you will be given different information, some in paragraph form, some in visual form. So four text about one healthcare topic, 20 questions and three types. It can be matching, it can be short answers completion, and it can be sentence completion. And you will have limited time, which is 15 minutes. In reading part A, reading part is structured to mirror your professional practice. It tests your ability to read expeditiously. Expeditiously, what does that mean? It means quickly, and by quickly, it means to read quickly and to retain information. Okay, and to locate information and then accurately record specific information. Okay, now they have given a sample task. I have also a sample task, but let's see what they are saying. For OET on paper, you have a separate question paper and text booklet. The instructions on the question paper instruct you to write your answers on the spaces provided and remind you about the 15-minute time limit. Okay, so what's next? They have this textbook contains your four text. Okay, let's we will not going to attempt it, but let's see. See text A. This is part A. In part A, as I have mentioned, there are four texts. This is text A. In this, they have mentioned what fractures, dislocations, sprain. Okay, and in text B, what they have telling you about simple fracture of limbs, in which they are telling you about immediate management, clinical assessment, and that in that you have to perform physical examination, then management. Okay, what is in the part C? In the part, sorry, text C. In the text C, they are telling you about drug therapy protocol. Again, see, this is visual format. Okay, this is they have given you a table. Okay, they have not provided too much text. They have provided you with a table in which one section you have drug, in one column you have form, the other is strength, the other is route of administration, recommended drugs, and duration. So this is table format. In, for example, if they have asked you any question, let's say about morphine, if they have asked you what is the strength of the morphine, you know it's 10 mg per ml. And if they have asked you about in questions, what is I'm sorry, uh, what is the dose of morphine if given IM, then we know that in IM it is 0.1 to 0.2 mg per kg. But if they have asked you about IV dose, then this is the IV dose. So this is how you interpret the table information. And I'm sure all of you guys here are healthcare professionals, and you must have this skill already, how to interpret tables. But what happens in the exam is that, as it is mentioned, that is it is a very limited, you have very limited time in this part. So what happens, sometimes people mess up. For example, if they have asked about the route of IM, sometimes people may write the route, sorry, the dosage of IV. But again, this is as I mentioned, that you should only spend 5 minutes in the reading. For example, if they have asked you about subcutaneous dosage of morphine, or let's say whatever, then some people may get confused that there is IM, there is IV. But this is what is written here, this is subcutaneous SC. But sometimes what happens is, when we are reading quickly, we will only see IV and IM, because in most of our clinical setting, either we are giving dosages in IM form and IV form. But this is exactly what I mean. When you are giving 5 minutes to the reading, read it very clearly. Okay, and you have to read this part as well. Okay, do not neglect the last part of the table, please do not, because sometimes some important information are given at the very bottom of the table. And sometimes in hurry we tend to just ignore and carry on with the reading. Okay, like for example, provide consumer medicine information, advice can cause nausea and vomiting and drowsiness. Now these are side effects. It is not written here that these are the side effects, but it is written that provide information and advice that it can cause nausea and vomiting and drowsiness. But if there is a question in the below section that what are some side effects of morphine, then we will say, oh, there are no side effects written in this table, and we will just go through all of these texts, and we will waste our time. But here it is written that it can cause nausea, vomiting, and drowsiness. So please always make sure, do not ignore the bottom of the table. Last is what is written here. I'm sorry. Yes. So techniques for plaster backslave for arm fractures use same principle for leg fractures. Okay, anyways, just ignore it. I think I have taken this sample as well. And what is okay, so now that we have mentioned, there are matching questions. What is meant by matching questions? The first set of questions is always matching questions, and there are usually between 5 and 7 of them. For these questions, you need to decide which text we have seen. There are four texts in part A: text A, text B, text C, and text T. In this matching question, we have to make sure that in which text the that information is given. For example, they have asking procedures for delivering pain relief. Now what we will do is, as I have mentioned you, that you should give 5 minutes. Okay, let's say you have given 5 minutes to the text, you have read the text, you have gone through the text, you have retained the information. Now, yeah, you have 10 minutes left, and in 10 minutes you have to attempt three parts of the question: matching questions, short answers questions, and completion of the sentences. Now 5 minutes have gone, you are left with what, 10 minutes. Now give 3 minutes to part A. How you can do that? Now it is written procedures for delivering pain relief. If you remember that what have been given, in which text this is, just write it. But if you do not remember, if you have to go back to the test, just quickly, because this is what we are doing on the computer. But in real exam, if you're attempting on paper, you can go through it. Okay, you do not have to scroll up and down, so it will be really fast. So in which part is it is given, what is the, sorry, procedures for delivering pain relief? Can anybody tell me?
Sir, C.
Okay, anybody else? Anybody else? Okay, it's actually the C. Okay, why it is C? Because it is written here. Ampule strength, it can be given route of administration is IM and IV. So it was really easy. You have known this. It's simple. Again, simple. Similarly, the procedure to follow when splinting a fractured limb. What is this? What is the procedure? It should be, I think, in the part D. Okay. Similarly, go. You should only given 3 minutes to this part, and easily in 3 minutes you can these 7 questions. And likewise, when you are given, for example, this is what the next part is, you are done with matching question. The next part is short answer question. The next set of questions will either be short answer or sentence completion. However, you need to answer each of the question with a word or a short phrase from one of the text. Each answer may include words, numbers, or both. You should not write full sentences. Okay, so in this part, for example, yes, this part, what is the maximum dose of morphine per kilo of a patient's weight that can be given using the intramuscular route? Okay, so now let's go back to that and see what is that can be given IM. Okay, so what is it? Can anybody tell me? Here it is written. Anybody? Are you guys here with me or not? Guys, can you
B.
hear me? Sorry?
B.
No. It's not B. It's actually, so now we are not
Sorry, sorry.
attempting, now we are not
No,
attempting the
no.
matching part. We are attempting the short questions. In this part, you will have to write, the answer. Okay, Salman, you are saying 0.2
A sling
mg
for
per, sorry?
sir. Show me the question again.
Okay, the question is, here it is the question. The question is, what is the maximum dose of morphine per kilo of a patient's weight that can be given using the intramuscular route?
10.
Okay, read it. Read it again.
Maximum dose.
Of morphine
IM.
per,
Okay, sir.
okay. So what is the
Okay.
maximum dose per kilo that can be given?
Um, 10 mg.
No, actually, Dr. Salman has given the answer. It's 0.2 mg per kg to a max of 10 mg. They have asked you what is the maximum dose per kilo of a patient. So per kilo is 0.2 mg per kg. Okay. 10 mg is the maximum dose that can be given, that can be given in one day, or that can be given in one in 24 hours. Up to max of 10 mg you can give that. But what is the maximum dose per kg? Okay, the per kg maximum dose is 0.2 mg per kg.
Okay.
Okay. And in this part, for example, some people, for example, let's say it was not 0.2, let's say if it has been 5 mg per kg, now you can write 5 mg per kg like this. But you can also write 5 in letters, mg per kg. Both are acceptable. Okay, both are acceptable. You should not be confused in that. Okay. Dr. Mansha, are you clear about it?
Yes, sir.
Okay, perfect. So the next thing is, so this one was matching, this one was short answered, and the next part is sentence completion questions. Sentence completion questions work in a very similar way. Again, you should read the sentence, locate the correct test, and read carefully to find the exact answer to fill the gap. Okay, let's say, what should we do? What should we do? What should we do is, okay, let's see this one. make sure the patient isn't wearing any dash on the part of the body where the plaster back slab is going to be placed. Now, I think the answer for this is given in the text D. So now we have read the text, we have read the four parts. We know that the answer of this is in the text D. Let's go back to the text D and see what is the answer. Again, guys, please read it, the number 17, and I want you to locate the answer in text D. Make sure the patient is not wearing any dash on the part of the body where the plaster back slab is going to be placed. Okay, let's go back to the text D. I think it is in the text D. Let's see. Okay, what is the answer? Anybody?
Jewelry.
Yes,
Jewelry.
yes,
Jewelry.
yes, absolutely right. See, here it is written, ensure any jewelry is removed from the injured limb. Now, the question was that make sure the patient is not wearing any dash, okay, where the plaster back slab is going to be placed. Now, if we are somebody who needs to be fed by the spoon, we will be get confused that we will get confused that, you know what, it is not written. So this is one of the example that question can be given in a different way, but it means the same. For example, here it is only written that ensure any jewelry is removed from the injured limb. Now, the text is about technique for plaster back slab for arm fractures. We know that this text is about placing a back slab on the arm fracture on the injured limb, and the point 5 is telling us about that ensure any jewelry is removed. So if you are not finding the exact statement in the text, please do not look for the exact statement, but try to look for the answer. Okay, and this is exactly how you are going to ace part A. But if you are somebody who gets confused and who is actually looking for the same text, for the same wording in the text, in the above text, and trying to look for the answer, you will waste time, and also you will probably going to get the answer wrong. Okay, so let me stop. This is sharing. Everybody clear about this? I will share a sample. Everybody, are you guys so far? Tell me, clear about this one or not? Please tell me so I will know. Okay, Salman. Let me see which text should I give you here. Okay, we will practice one. Let me see, I have two of them. Which one should we practice is the question. Okay, guys, are you guys there with me? Yes, there we go. Okay, can you guys see the screen? Everybody, can you guys see the screen? Yes. Okay, everybody, what I want you guys is please take a pencil and please take a paper, please take a notebook, because right now I'm going to make you attempt this one and I will be with you guys. Okay, please. And I will put the timer as well, because I'm going to make you practice and I'm going to make you aware that this is how exam is all about. Okay, please take any paper and pencil with you guys, and we'll see. Okay, let me put on the timer for 5 minutes. Okay, everybody ready? I'll put on the timer now. Everybody, are you guys ready?
Yes, ready, sir.
Okay, so see again, this is another sample, and again, as we have mentioned that it is part A, and in part A you will be given 4 texts, okay, and we will only take 5 minutes to read these 4 texts. Now, as I have the control of the computer, I am in the control of scrolling up and down, so I will give you enough time to read each text, okay? So your time starts now. Please read the text A, okay? Take your time. I'm not going to dictate it for you. Please take your time. I'll give you enough time, and please read the text A. Okay, I think this is enough. I'm going to scroll down to text B. Okay. Now this is again a visual part. Take your time. Do not rush. Have a look at this one, text B. Okay, I'm going scrolling down to text C. Again, take your time. Carefully read it. Carefully. You do not have to memorize it all, but just have a look and try to understand which information is given in which text, in which part. Okay, I'm going to scroll down now to the last part, which is text D. Take your time, carefully read it. Everybody, have you completed reading? Please tell me. Do you guys want me to scroll back to any part? Okay. Okay, you know what, actually, okay, so I will share this. See, we have 33 seconds left, but when I have asked you guys, have you guys finished reading? I have actually, it was actually 4 minutes and you guys have 1 minute left. Okay, so see, if you give yourself enough time and if you're not rushing, you can actually finish reading in 4 minutes. Okay, I had 1 minute spare, and at that period, I asked you guys, have you completed reading? And you guys took 30 seconds. So we still have 1 minute. We still had 1 minute left. Now, uh, everybody, can you please briefly tell me what was given in each part? As I mentioned, that you do not have to cram all the information, but now as you have read for text, can you briefly tell me what exactly is given, what information is given in each text? What is given in text A, what is given in text B, what is given in text C, and what is given in text D? Anybody who can tell me that? I'm not going to scroll back, because if I'm going to scroll back, then you can see, but anybody who has returned that information till now.
Sir, in part A, they are giving about the information of the type of injury and how much injury, and the type 2, what type of injury, closed type or open type, they are described,
Okay.
and the type 3, uh, high risk and low risk injuries. What are the features of high risk and low risk? And D, they are described what are the precautions or what are the care for the injuries.
Perfect, perfect, Dr. Mansha, perfect. You have aced it. Sadia, yes, it is management of head injury. It is actually, the part is about management of head injury, but they have four text. It is four texts given here. Can you please tell me what exactly is given in each text? What is given in text A, B, C, and D subsequently? Can you tell me that? As text D is on the screen, we can see it is an advice, or it can be information given on the discharge. We can see that in the text D. What is given in text C, and what is given in text B, and what is given in text A? Dr. Mancha have told me. Anybody else who can just tell me briefly? Guys, anybody? See, this is your practice. This is exactly how you're going to prepare yourself. If you're not taking part, if you're not practicing with me, then I don't think this session will be used. This session will be of any benefit to any of you. Please try to participate and try to practice with me. Can anybody tell me, other than Dr. Mansha, what exactly is given, what information is given in each text? Just briefly, as told you that you do not have to cram it all. You are going to go through these texts again and again when attempting the questions. But now that you have read, you should know, you should have an idea that you know what is text A about, what is text B about, what is text C about, and what is text D about. Anybody who can tell me that? I don't think anybody is interested in that. Okay, let's see. We'll go back and we will see. As we have read text A, in text A, what is given? It is given primary care guidelines on management of head injuries. But a type of injuries, Salman is saying B is evaluation, C is dangerous signs in T20. Yes, Salman. Perfect, perfect. But in A, it's not actually the type of injuries in text A. It's actually just guidelines. See, management of head injuries, it is just saying that when a patient comes with monitor observations like BP, GCS scale, and then notify the medical officer, prepare for intubation if GCS is less than 8 or less, maintain BP, keep patient warm if there is a rapid deterioration in GCS of 2 or more, and if one pupil becomes fixed and dilated, this may indicate expanding hemorrhage. Consult MO immediately. Give opioids with caution to the patients with head injuries. If the skin is broken, check tetanus, vaccination status, administer tetanus containing vaccine, and assume all head injuries have associated neck injury. Okay. Okay, got it. Perfect, Salman. No problem. So far, you have done well. It's just in text A you got confused. It was not actually typed, but you have done well, very well. I'm happy with you. In text B, what is given? In text B, it it is a graph which is actually showing us if there are two types of head injury, closed head injury and open head injury. It is telling us about what are the next steps. Okay, if there is a closed head injury, these are the next steps, and if there is open head injury, these are the next steps. And again, as I have mentioned, they are telling us about next steps. Again, it can get confusing sometimes as we can say this, but do not get confused. Just read it that they are saying if there is any immediate high risk, yes, any, then CT scan is required. But no, then you will monitor for 6 hours. If the observations remain same, the patient may be discharged, but you have to arrange an MO review in next clinic. Okay, but if you have monitor for minimum of 6 hours, and if the observation becomes abnormal and patient deteriorates, you have to consult MO immediately. Perfect. Okay, now this part, if the CT scan is required, CT not, then consult MO to perform CT. But if what if CT is not available, then if any of the following, that GCS is less than 15 at 2 hours post injury, there is deterioration in GCS, there is focal neurological deficit, there is clinical suspicion of skull fracture, and there is persistent abnormal mental status or vomiting or severe headache 4 hours post time of injury, then consult MO immediately and they will organize evacuation, because these are the signs of intracranial hemorrhage. Perfect. See, it is not as confusing, as hard as it is look, as I am, reading it with you guys, reading it out loudly. At first glance, it may look confusing, but when you have a pencil and when you are reading and then when you are underlying everything, you get to know it's not actually that confusing. It's very simple. So part A was about management of head injury, or we can say the clinical management, the general guidelines. If someone present with the head injury, what should we do? We should measure GCS, then BP, then maintain BP, keep the patient warm, then consult the MO, and then give him opioids, give him tetanus, get to know about his vaccination status, and assume all head injuries are associated with neck injury. Text B is about closed head injury versus open head injury. What you have to do if the GCS is less on an arrival, then perform routine clinical assessment, then again review. Then you have to see if there is any risk factor, then go for CT. If there is no any risk factor, then retain it for 6 hours. If there is no any deterioration, then the patient can be discharged and he or she should be reviewed at the next clinic. But if after 6 hours of monitoring the patient deteriorates, then what's next? Then consult the MO for immediate evacuation. And then again, if you go up, if the CT was not available, then what? Then you see for the signs, for any basal fracture, if there is any clinical suspicion, if the GC is deteriorating, if there is vomiting, or if there is any focal neurological deficit. Okay, what is text C about? Now, text C is about head injury clinical features in the child. What are the intermediate risk factors and what are the high risk factors? Okay, now again, as I mentioned, that you should not and you should not, absolutely not, memorize it all. But let's see what are the some clinical features and what are some risk factors, intermediate risk factors and high risk factors. Age less than 1 year, it is intermediate risk factors. And loss of consciousness, if it is less than 5 minutes, it is an intermediate risk factor. And similarly, if it is more than 5 minutes, then it is a high risk factor. Again, episode of vomiting 3 or more, then it is an intermediate risk factor. Seizure, impact only, yes. Okay, I'm sure you guys have an idea. Now, in the text T, there are advices, okay, for patients who have received an injury to the head. What are advices? Rest, use ice pack, take simple painkillers. If an injured patient is discharged, he or she should be make sure that they are woken up several times during the night. Do not let them drive. Do not let them leave alone. Do not let them drink alcohol. Do not let them eat anything for 6 hours. And do not let them take sedatives. Return to the clinic if the condition gets worsened or if they have vomiting episodes, blackout. Okay. So now we have an idea about everything. Text A, B, C. I have actually read it out loud for you guys as well. Now, we had 5 minutes and we have taken more minute to again review. Now I will put on the timer for 10 minutes, and now I am going to make you attempt. Please keep your pencil and paper with you guys. Okay, with each question, I'm going to give you a few seconds in each text so that you guys can see what exactly is the information, and we're going to attempt the questions. Okay, everybody ready? Please tell me. Are you guys ready with pen and pencil? Sorry, pen and paper? Thank you, Sadia. What about other people? Are you guys ready with the pen and paper? Perfect. Salman is ready. Dr. Mansha is ready. Jashila, I think you're traveling, so you would not have any pen and paper with you. Khadija is ready.
I
Perfect.
have, sir.
You
I have,
have?
sir.
Okay,
Yes, sir. Yes,
perfect.
sir.
Okay, let's start then. Let's start. I will go to the question parts and I will start the timer again. So what is the time? You have, you have 15 minutes. Look at the four text ND in the separate text booklet. For each question 1 to 20, look through the text. 80 to find the relevant information. Write your answers on the spaces provided in the question paper. Answer all the question with 15 time limit, and you should answer and your answer should be correctly spelled. Yes, absolutely. Please make sure, please take care of the spellings. Okay, the timer has started. Now, question 1 to 5. For each question 1 to 5, decide which text A, B, C, or D the information comes from. You may use any letter more than once. In which text you can find the information about number 1, what patients should and should not do when they return home. Okay, I think everybody knows this. Write the answer. Please do not dictate in the chat section. Write it on the paper. Okay. Number 2 is the possible cause of abnormality apparent in patient eyes. Okay, for this, uh, anybody wants me to scroll up for this one?
Please, sir, scroll up.
Okay, I will scroll up for this. I will give you brief time for in each text. Please, the reason for abnormality in the patient eye. Okay, in which text it is given. Take few seconds here.
Okay, sir. Done.
Okay, now take few seconds at the text B. See if there is any information related that here.
No.
Okay, now look at text C.
No. So it is mentioned the
Just write it. Please do not tell me the answer now. Just write it. Okay, and have a look at text D as well. Okay, now let's look at the question 3. The reasons why patients should seek medical attention after being discharged. Which text? Anybody wants me to scroll up for this question?
Yes, sir.
Okay, please keep remember the question. The reason why patients should seek medical attention after being discharged. What is the reason they should seek attention after being discharged? Take a few seconds at text D. Few seconds at text C.
Got it, sir.
Okay, now as you have got it, the fourth question is procedures to follow dependent on the type of head injury. I think everybody should answer this question without me scrolling up. Everybody has got this one, the fourth one?
Got it, sir.
Okay, the last question is in this one, the past interventions and conditions to be considered when assessing risk. Do you want me to scroll up again?
Yes, sir.
Okay, I will again go text D. Have a look at text D. Few seconds here in text B. Sorry, C. Okay, here in text B. And then a little brief here at text A. Okay. 5 questions are done. Let's have a look at 6 to 11. Now, what should we do? Answer each of the questions with a word or a short phrase from one of the text. Each answer may include words, numbers, or both. Okay. So, children present with head injuries are assessed as high risk if they had memory loss lasting. I will go up or more. Okay. Now, see, I can understand this part can get confusing because you have to scroll up and down so many times. But in the real exam, you will be given another paper, and so you can always have a look and compare both of them. Here, I can understand it's get confusing. Okay, let's go. If they have a memory loss of what? Have a look here. Okay, so what is the next question? The next question is or more and fallen. Okay, or more and fallen dash. Fallen what? Fallen what? Have a look at here. Okay, fallen. You have seen now. Uh, or more, being hit by a weighty object or one moving at dash unusual levels of. We will see 8 and 9 together. Being hit by an object which is moving at what and unusual levels of. Being hit by an object moving at what and unusual of. Okay, now the last is, I think is the last one. Yes, unusual levels of dash, a dash which gets worse over time. And the 11th is children assessed as intermediate or high risk should undergo. I will go to the part where it is written. Anybody who is intermediate or high risk should undergo what? You can have a look here and you can have a look here at as well. Okay. Now, question 12 to 16. Complete the sentences below by using a word or a short phrase from the text. Each answer may include words, number, or both. Okay, again, all the patients presenting with dash head injuries must be referred to the MO. What? Let's go to the text A and C. And have a look at text B as well. Okay. Now the next question is, patients with GCS below 8 may need what? Can anybody tell me in which part the answer is given?
Part A.
Yes, perfect. Okay. The MO should be informed without a delay if there is a drop in BP or in a change in patient's level of what. I think it's very easy. What? Do not answer it, but please write it. Okay. And staff should be especially careful when administrating dash to the head injury patients. For this, I will go to the text A and have a look. Staff should be careful with what exactly? Okay, it is important. I know it is given in part A, what exactly they should be, cautious about. Okay, now the other is, sorry, even I am getting very frustrated with this scrolling. Head injury patients may also have an injury to their what? It is also given in the text A. What exactly is this? Write it. Now, last four questions. If there are no significant risk factors, how long after a head injury can you discharge the patient? If you guys want me to scroll up for this, I will. If you guys do not want me to, I will just keep it here. Okay.
Yes, sir, scroll up.
Okay, I will go up. The answer is given here in the text B. I will save your time. Go here. Okay, I think it's enough. And the other thing is where the 18th question is that what should you provide head injury patients with when you discharge them? What you should provide them. It is given in the text D. Okay, please have a look quickly. Okay, now the second last question is what should you advise patients to take to control headaches? Oh,
Sir,
the
scroll
timer
up.
is okay. The timer is up, but it's okay because we have been scrolling up and down. Here it is. The answer is given here.
Painkillers.
Okay. The other question is that what should you advise patients to take control of headaches? This is given. Now, the last question is what patients can use to avoid contact between ice packs and their skin? What should they use to avoid contact between ice packs and their skin? Okay, it is also given in text D. What should they do to avoid contact between ice packs and their skin? Okay, so we have taken 30 seconds more than 10 minutes. As I was here dictating you guys and I was scrolling up and down, I was going at my pace, not your pace. So if you have a paper, if you have been given this paper, or if we have attempted in which we can have access to all of the parts in one glance, trust me, it would have taken around 7 to 8 minutes, and you guys would have been left with 2 extra minutes in which you can actually revise and review your answers. But still, having attempted it in the first attempt for the very first time in 10 minutes and 30 seconds is quite good. The reason for this demonstration was to actually make you understand that 15 minutes are enough, and if they have given you a limit of 15 minutes, they know that it is doable and it is not something that cannot be achieved in 15 minutes. Okay, so everybody, can you please tell me? I'll share the answers with you guys. Everybody has written answers?
So I missed the 7, 8, and 9 question
You have missed 7, 8, and
because of
9.
sir immediately scrolling.
Okay, no problem. I will share the screen again. No problem, no problem. It was just a demonstration, but 7, 8, and 9. I will again share the screen with you. Do not worry about that. I also, Khatija, what questions did you miss? Please tell me. I will go there. It was Dr. Mansha, it was you or Jay Sheila who was saying that you have missed question 7, 8, 9. Who was it? Uh, who was who told me? Please, can you please tell me again? Who missed question 7, 8, and 9? So, the question 7 is that children presenting with head injuries are assessed as high risk if they had a memory loss lasting dash or more, and fallen dash or more, and been hit by a weighty object or one moving at dash and unusual levels of this. Now these are three questions. What we are trying to understand that one we can it is about amnesia. Amnesia lasting more lasting what? Okay, or if they have fallen, it is again fallen from some height and been hit by a weighty object or one moving. One moving means it is about the speed. So this is about the height. This is about the speed and unusual levels of what exactly. So this we will see now. Okay. Dr. Mancha, was it you who missed these questions? Please tell me.
Yes, sir.
Okay, so now see the answers here in this part, please. The first was that they have fallen from some height. Okay,
Okay, sir.
okay, and the other, and again, okay, before answering your question, please understand they are asking you are assessed as high risk, not intermediate risk. Okay, so high risk, please make sure you answer high risk questions, not intermediate. So please, fallen from what height? Okay, and being hit by a weighty object or some object which is moving. So where is the speed? Okay, and the last thing was unusual levels of what exactly? Have you answered?
Yes, sir.
Okay, anybody who wants, Khatija, you said you have missed. Can you please tell me what questions did you miss?
Sir, 18 question, question number 18.
Mm-hmm. Question number 18.
Show me the question number 18. Yes, sir.
Okay, wait. Question number 18. Okay, wait. Let me share my screen with you. There you go. So it is done. Okay, thank you, Khatija. So here the question 18 is what should you provide in head injury patients with when you discharge them? Okay, what you should provide with them. Now let's have a look. It probably is given in text D. What should you provide a patient with who has received a head injury? Let's have a look at text B as well. Maybe the answer is given here. Maybe.
Okay, sir.
You have got it?
Yes, sir.
Okay. So now I will dictate the answers and everybody please make sure that you know and match your answers and tell me that how many marks have you got so far. Okay. So in which text can you find the information about the patient, what patients should and should not do when they return home? It was, I think, this easiest one. It is in the text D. Okay, everybody match it with your question text D. Okay, the possible causes of abnormality apparent in a patient's eye. It is in text A. The reasons why patients should seek medical attention after being discharged. Again, it is in the text D. Now, procedures to follow dependent on the type of injury. What is the procedure dependent on the type of injury? B, it is the given a visual chart, head open head injury versus closed head injury. Okay, and fifth one is past interventions and conditions to be considered when assessing risk. It is given in part C. Okay, now what are the next questions? Yes, now child had presenting with head injuries are assessed as high risk if they have memory loss of lasting 5 minutes. Okay, now it can be written as 5 minutes. Okay, it can be written as five in letter and then minutes, and it can be written as five and then minutes. It's you can it can be written like this as well. Okay, all of these are acceptable. So 5 minutes. Okay, fallen 3 meters. Now please in meters, and always keep always make sure that you write meters in full letters. Please do not write it like this 3m. Okay, it is wrong. This one is wrong. Anybody who has written it like this, it is wrong. Okay, being hit by a weighty object or one moving at. Now this, I am sure many people have got it confused it with this one. Let me go up for this. Being hit by a weighty object or one moving at. Now, some people may have written maybe 60 kph, or some people may have written heavy high speed or heavy project high speed. Yes. Now, what is the correct answer? The correct answer is high speed, because they are not asking about motor vehicle. They are asking being hit by an object, heavy object, or one moving at with high speed. This is the right answer. Okay. Force, it can be, see, force is very clear, being hit by a heavy object or one moving at with high speed. So please, if anybody has written or wrote 60 kph, you have got it wrong, because it was one of the confusing question. Okay, now we have done this. And unusual levels of what? Okay, unusual levels of drowsiness, where it is given. Let me go up. Unusual level, because as I said that if you are looking for the same wording and same statement, you will get confused. Now here it is written unusual level of what? Now unusual levels of, we can imagine that it can unusual level of behavior. See, here it is behavior, mild agitation or altered behavior. Now we are looking for high risk factors, so abnormal drowsiness, so unusual levels of drowsiness. See, here it is written abnormal. Abnormal and unusual are synonym. So please, anybody who knows this synonym would have gotten it very correctly, that it is about drowsiness. Okay, unusual levels of drowsiness. Okay, now the 10th part is unusual levels of drowsiness, a dash which gets worse over time. What is 10? It is headache. Headache which gets worse over the time. And exhalation, children assessed as intermediate or high risk should undergo what? CT scan. Okay, now the question 12 to 16 are, let me scroll on. Yes. So all patients presenting with dash head injuries must be referred straight to the MO open. It's very simple. I think we should not scroll up for this. Patients with GCS below 8 may need what? It is intubation. It is given. Anybody who is working in ER will know that anybody who presents with GCS 8 less, you should have to call the anesthesia department. It is a high risk, and then you should always get ready for intubation. The MO should inform without delay if there is a drop in BP or change in patient's level of. Now, this is also very confusing. Some people may have, I think maybe some people have written GCS, but it is wrong. there is no level of GCS. Okay, if it was GCS, it would have been written change in patient's dash. It would not be written as level of consciousness. Okay, consciousness is the right part there. Again, they are talking about GCS, but they have written it in a very I would say tricky manner, just to confuse you guys. Now staff should especially be careful when administrating what opioids. Okay, head injury patients may also have an injury to their neck, as it is written in the part A that every head injury is considered to be associated with the neck injury unless proven otherwise. Okay, it is also what we have been taught in medical throughout our medical journey. Now, last four questions. If there is no significant risk factors, how long after a head injury can you discharge patient? 6 hours. Okay, now it can be written like this and it can be written in letters as well. What you should provide head injury patients when you discharge them. Again, it is in text C, not text in text B, not text D, not text C. It is advice sheet. Okay, advice sheet. Now, what should you advise patients to take control of headaches? It is painkillers. It is written in text D. If somebody has written simple painkillers, yes, it is also right. It is also considered to be right. Okay, no problem with that. Now, what a patient should use to avoid contact between ice packs in their skin? Towel. As I said, please do not go for the same statement or same wording. It is written here in the text D that see that wrap ice cubes, frozen pieces of sports in ice pack in a towel. Do not push ice directly on the skin. Okay, so now everybody, please tell me what are your marks? What is your score? I want to know everybody's score. Everybody, please. 15, Khatija, well done, very well done. 15 is very good. Dr. Mancha 17. Perfect, Dr. Mancha. See, you're getting it right. As you have been saying in the last session that you're not good, you are actually very good. Salman and Sadia 13. No problem, Salman and Sadia. Even in the first attempt, 13 is good because as I said, I was in the control of scrolling up and down and I was taking my time. Okay, I was going through at my pace, but I can understand you guys may have different pace. You guys may need more time. So please, if you have scored 13 at my pace when I am in control, I'm sure you will score more than 50, more than 17 when you are going on your own pace. Okay, practice this part and you will score more. Jay Sheila 17, perfect, very good. And I think somebody has left. Dr. Manshai, who is this iPhone? Who is this iPhone in bracket 9? You do not have any name. You do not have any participation in this. Who exactly are you? Can you please tell me your name and how much have you scored? Have you attempted at all or not? So, as I told you that this will be a very short session and it will be about part A. So anybody, stop sharing the screen. Anybody who has any question regarding part A, please tell me before we end the session and before we sign off. Any question, anything. What are your queries? Have you find it difficult or what? Please let me know. Give
Time
me,
management, sir.
sorry?
Time management, sir.
Yes, exactly. What exactly is your problem with time management? Did you find it difficult today to manage the time?
Not only today, sir. Most of the times, so part A, 1 to in this part they have given only 6 questions, but others is they given 7 questions. 1 to 7 is very easy. We can crack it within 2-3 minutes. But
Okay.
rather than to 7 to 20, it's bit difficult to maintain the time, sir.
That is exactly what I have told you today, that you should always break your time, break it in the parts and assign some minutes to some parts. So if you assign 5 minutes to reading, and trust me, 5 minutes are more than enough. If you read very carefully, do not just go through it, try to read it very carefully. Okay, and if you give 5 minutes to the reading, and then if you take 10 minutes, as you yourself mentioned that part, question 1 to 7, yes, I can understand. Sometimes it can be given 5, sometimes the questions are 7. So as you yourself said that question 1 to 7 or 1 to 5 are very easy and they are attempted in less
Yes,
than a
sir.
minute or maybe a minute, then you are left with 9 minutes. 9 minutes are very, it's an ample time, it's enough time to answer those questions in which you actually have difficulty. So time management, yes, it is a trick, but the key to that trick, it what is the solution? The solution is you break your time and you assign few minutes to reading and few minutes to each parts, and that is how you are going to manage, and that is how you are going to answer every question in 15 minutes. Otherwise, if you do not have a strategy, if you do not have a plan how to attempt this part, then yes, you will struggle, you will struggle, everybody struggle if they do not have a plan, if they're going it blindly, if they're going to attempt it blindly.
Okay, sir. Thank you.
Okay, understood. As I think you are traveling today as well, so even if you're as you are traveling and if you are traveling and uh, while traveling, if you have attempted this and you have scored 17, then I'm sure when you are at your own comfort, in your comfort zone, you will score actually 20, inshallah.
Yes, sir. Yes, sir.
Okay. Anybody else who has any question? Dr. Mancha, do you have any question? How are you feeling? Are you feeling confident in yourself or not?
Yes, sir.
Okay, perfect. Good. Salman, Sadia, Khatija, guys, can you please tell me, especially Salman and Sadia? Salman, I'm asking if you have any question. Not yes, sir. Do you have any question? Do you find anything difficult? That's what I'm saying. Sadia, you too, please. Okay. Okay. I actually ask you guys specifically because you scored 13, and I understand. I totally understand that, you were attempting this part at my pace and also looking at the screen when I am scrolling up and down. It is frustrating and it can get difficult at some time. So I understand. What I advise you guys is please see. We had two sessions. Today was our third session. We had a speaking session. We had a writing. I was getting confused. Yes, I can understand, Salman. I can totally understand that. Okay, I apologize for that. As I do not have any alternative for that. I will try to do what I will try to. Uh, what I will do is show you guys with multiple screens so you guys have each part at one glance. I will try to do that, but I'm really sorry. For now, I do not have any other alternative for that, so I can understand. This was our third session today about reading. We had done speaking session, we had done writing session, and tomorrow, inshallah, we will be doing listening session. And again, we will be doing part A for the listening session. Okay, so what is my advice? After each session, please, even if you feel confident, even if your session goes well with me, if your practice goes well, do not try, keep practicing at your own as well. Okay, keep practicing. After a speaking session, you should have been practiced speaking. Same for the writing. I have given you a task, that is one of the practice, but even at your own, please keep on practicing. And same goes for reading, keep on practicing this part A. So please try to focus on part A. The next session will be on part B, and till we have part C, please try to keep practicing part B till we have part C. And in the fourth session, what I will try to do is we will try to attempt every part in one go. For example, today we have attempted part A. In next session, we will be attempting part B, consequently part C. And in the fourth and final session, I will try to give you a reading test. Okay. We will see what we will do in the fourth week. Either we will try to take a full-fledged reading test, or I will ask for your feedback. What should we do? Okay, the fourth week is not decided yet. We will be deciding that with you guys. But for now, we are going to break each subtest in parts and we are going to attempt that. But after each session, keep practicing till next session. And that is how you will improve. Okay, that is exactly how you are going to improve in your practice. If you're going to practice reading as a whole, okay, yes, you will. But then again you have to practice speaking as well, you have to practice writing as well. So this is the key, try to practice each subtest in uh, parts. Okay, do not go at it at in one go. So I think this was enough. Any question before I end the session? Anybody? Any questions so far, guys? Any confusion, any suggestion, any feedback, anything?
Sir, is it better to attempt the first 5 questions in the last few minutes?
Is it better to attempt the first 5 questions at in the last time? Are you saying that is it okay to attempt the first 5 questions at the very last? Is this your question?
Yes, sir.
I think, see, what I would suggest is what my answer to that question would be. I think it's not ideal because if you because question 1 to 5 are very easy, okay, and as you have finished reading, your mind is fresh with what is the content of each text given in that part, text A, B, and C. So once you have finished reading, you are very fresh with what is the content of each text. So question 1 to 5, if you are attempting that at the very end of your reading session, like when you have actually just finished reading, so you are fresh with the knowledge, I think it will be easy for you to attempt that. But if you are going to attempt it at the very last, then again you will have the pressure. You know what, that I'm taking time in these long questions. I have uh, those questions left which are very easy, in which I just have to match, in which literally I just have to write A, B, C, and D. So I think it's better that you attempt it in the first minute, and then the other parts, as they are going to take your time, and also you have to write long words, long phrases. So it's better to attempt. It's better to go in a chronological manner. Okay, do not jump around the questions.
Okay, sir.
Okay. Any other questions? If there are no questions, then I'm going to end the session now. Okay, I think it's nobody has any questions. Okay, guys, take care of yourself. Okay, and keep practicing. Please keep practicing. This was a practice session with me, but please keep practicing on your own, and that is how you're going to improve. Okay, we will meet tomorrow, inshallah, and everybody take care of yourself, and we will see each other again tomorrow. Okay, take care, guys.